Anxiety can be crippling. If you don't have a serious problem with worry, I'm betting you know somebody who does. Anxiety is the most common behavior disorder in people, and the same is true for dogs and cats. You know, there is safe treatment. Nobody should have to live with that kind of misery. In case we haven't met, I'm Dr. Jeff Nickel, along with the Nickel family border collie, Miss America, and Gaston and Tony will rotate around here in just a minute. These cats are on the move. I want to share with you some non-pharmaceutical treatments. I don't mean to suggest that medications, which are FDA approved and highly researched, are a bad thing. Sure, everything can have side effects and there can be safety issues, but we have well-researched treatments that always should include generous doses of kindness and patience and behavior modification and management changes, because we want to do everything we can to improve life for these pets because we love them and they're important to us. Miss America, you're upside down. Well, come on up here and sit up. That's a big girl. There you go. So I'm going to talk about a whole bunch of different stuff here, and you might find some of this information helpful. And so if you do and you have friends who might also benefit or their pets, by all means tag them. And you're welcome, in fact I encourage you to interrupt me anytime with questions about pets. And it doesn't have to be on natural or supplemental therapeutics either. It can be on really any behavior disorder or even physical issues for that matter. Beyond my behavior residency, I practiced general medicine for many years. So, you know, I've pretty much seen it all by this time. So, you know, anxiety, I mean, you can recognize it in a lot of different ways because it can be manifest in so many different behaviors. For example, dogs with separation anxiety are often the ones who whine and cry. Some of them destroy the door, do a lot of other damage, might even house soil, hypersalivate when they're home alone. Cats, by the way, often have separation anxiety, but they manifest it differently. Very often they do it by urine soiling in their person's absence. So yes, we treat urine soiling in cats a lot, and very often the problem involves separation anxiety for them. And Cindy, excellent, thank you for coming. I hope this is helpful to you and your pets. But you know, we also see pets with anxiety-related phobias of loud noises like fireworks and thunder. They might hide and tremble. We also have generalized anxiety, which is really a growing list. It's a problem that generalizes by becoming anxiety-related symptoms to a growing list of triggers and stimuli. And that can get to the point where the pet is anxious pretty much all the time, hypervigilant, pacing, not resting. Again, this really interferes with well-being. And then there are those where it's just context specific. You know, in other words, they feel pretty good most of the time, but then sometimes there's a particular type of event like guests visiting or seeing people and dogs walk past the house, or things that just ratchet up their arousal to the point where they lose impulse control and they can, you know, bark excessively, they can jump at the window, sometimes even redirect toward another pet or even a person and become aggressive. So anxiety can take a lot of different forms, and we've got a whole lot of different ways of treating it. And today I want to talk about stuff that is not, you know, FDA approved medication. You have to be careful with that kind of stuff, because if it's a supplement, if it holds itself out to be nutritional, then there is no obligation legally for a manufacturer to prove that it's safe or effective. And if you're not careful, you can cause trouble. So we'll talk a little bit about that too. And Richard, oh, wonderful. I'm glad you're here too. Thank you. So the kinds of things I want you to understand is that the serious behavior problems are not probably going to be significantly improved with supplements like nutritional things that we're going to talk about, and pheromones, and a pulse electromagnetic field stimulation like the Calmer canine, which we'll talk about again as well. If you've got a real serious problem, some of these things aren't going to be enough by themselves, and you will need the help of a veterinary behaviorist. There are PhD behaviorists who are excellent as well. I'm a veterinarian, residency trained and credentialed as a specialist in behavior medicine, and so we understand the physical aspects and other body systems, not just the brain. Nonetheless, you want real qualified help if you've got a severe anxiety-related problem in a pet. So let's talk a little bit about these nutritional supplements. You know, for one thing, if you've got a pet who is on a high-protein diet, like these raw meat diets, the trouble, among a few other things, and I'm not going to go into depth with raw diets unless there's a question, but they typically are high in meat, and meat protein doesn't have a lot of tryptophan. And the trouble is that those dogs on higher diets, higher meat diets, are at greater risk of becoming aggressive. So tryptophan can make a difference, but you've got to be careful when you add tryptophan. In humans, there was a problem a number of years ago where it created painful muscle disorders by people taking supplemental tryptophan. So the best way of getting that is as part of a balanced diet. And there are a few canine diets, one called Royal Canine Calm diet, and they have a feline as well that has tryptophan and alpha-casazepine, which we'll talk about in just a minute. That's a big word, but we'll talk about that a little bit. Let me tell you a little story. I've got a couple of cases. One's real right up close and personal here. But this is a story of a nice lady in Santa Fe who has two pets, a dog, a small dog, 20 pounds roughly, named Buddy, and she has a cat named Katie. Katie had been in the household for a long time and had done just fine when she adopted Buddy, this little fireball of a guy. And, well, he saw that cat, Katie, and all he wanted to do was chase her. There was no indication that he was trying to hurt her, but you know, how do you know, right? Dog's chasing the cat, and even if he never would hurt the cat, you're risking scaring the cat and diminishing its quality of life. And in this case, Katie was spending a lot of her time way up high on a shelf in one room of this lady's house, and not hardly ever coming down. So that needed some help. Well, the thing that we did, we treated Buddy for his issues, but with respect to Katie, the cat in particular, we started her on Angstane. And let me turn this around so you can see it. I've got a bunch of stuff I'm going to show you, so I'll do this a few times if it doesn't make anybody dizzy. But this is Angstane, and you notice it has something called L-theanine in it. These are chewable, and they really do like them. And it's good, as you could tell from the picture, for dogs as well as cats. There we go. And this stuff, I put on too much light here. Hang on. Get everybody blinded. There we go. And so Angstane here, again, you can see the dog and the cat. You give it twice a day. And that little girl, Katie, felt so much more relaxed. And I had instructed this lady on managing Buddy more effectively. And she started to relax and not react so much to Buddy. And ultimately, they became great friends, and she has sent me photos of them sleeping together, and so the fear is gone, and it's made a big difference. And this is an entirely safe nutritional supplement. Angstane has this, the L-theanine is a plant amino acid that's found in green tea. Of course, you could give green tea to Katie the cat, but she'd have to drink a whole lot of it. Okay, so anyway, it's dosed very carefully and very well-researched product. Another good case involves these two gentlemen right here. And when I say gentlemen, I sometimes use the term rather loosely. But Tony here, he's bearing down hard on 14 years old, the gray guy. But he had done well as our only cat for many years. And then one of my sons and I were walking Miss America here on the irrigation ditch near our house one night. And we found this little white fuzzy guy, all of about 8 or 10 weeks old, crying on the irrigation ditch. He had gone down to get a drink, and it had just rained. He was soaking wet. And just a little guy, and if he'd stayed out there very much longer, he would have been a coyote snack. So we picked him up and took him home, intent, of course, on finding his family. And after putting our signs out with my cellular number on it and nobody calling, we found out, well, we did find his family, and it was us. So here he is, and that was about 4 years ago. But he was a much younger cat than Tony, our existing cat, and he started picking on him. Gaston here, very sweet guy, but you know, Tony had a pulse, and he was moving around the house, and so he started swinging at him and, frankly, bullying him. So what I did with Gaston here, which is particularly good with cats in these situations, is I started him on this stuff, and it's called Zilkine. And let me turn the camera around. There we go. And this stuff is a capsule. Now, of course, anybody with a cat, and many dogs know that capsules or tablets can be pretty darn difficult to get cats to swallow. But the beauty of Zilkine here is it comes in a capsule, but you open the capsule and you dump the powder on the cat's food, and they think it's great. and it makes a significant difference. There's no side effects. He's just as active and playful, but he just doesn't pester Tony as badly, and Tony's quality of life is better. So, these things can have value. These were not severe problems, but they were certainly important to me and my family, and they are to everybody who loves their pets because who wants to see their pet miserable, right? Miss America, honey, you can come back over here and sit with me. It's okay, honey. It's all right. Jump back up here. That's a big girl. There you go. So, but there are lots of other things that we can use too. So, for example, let me talk to you a little bit about 5-HTP. Okay, fancy term, but you can find this on the internet. 5-HT or 5-HTP. It's really the same thing. And this is a building block of the neurotransmitter serotonin. It is something that is part of that series of neurochemical events in the brain that lead to the production of that really essential neurotransmitter. And when we have a lot of anxiety, it very often diminishes that, especially when it's manifest as aggression. So 5-HTP, yeah, it's a perfectly good thing, and you can get it on the internet. It is actually it follows tryptophan in the series of chemical events that lead to the production of serotonin. So you can use that, but you've got to be careful. Don't overdo this stuff. And I prefer veterinary approved products because I'm familiar with the research and I know it's real. It's not, the trouble with some of these generic products like 5-HTP is you're not necessarily sure of what you're getting. So here's one that is called Denicil is the brand name, but what's in this stuff is something called SAMe, and SAM, uppercase SAMe, and you can see it's S-adenosylmethionine. You can see that on the label. And this stuff we often use when we're trying to improve brain function, especially in older cats and dogs who have cognitive dysfunction, which is very similar to Alzheimer's in humans. And this is one of many treatments we'll use in that case. But it's also a very good way of providing the brain more of the neurotransmitter serotonin to diminish anxiety. And this is a veterinary product. It's something that is well researched, and your veterinarian can provide it. You may be able to find it online. So this is Denosyl. This will be backwards this time. Denosyl. Okay. So that's another one that I find very helpful. Now here's something that is really easy to find, is melatonin. And you can get this stuff online. You can get it over the counter in pharmacies like CVS or Walgreens, whatever you like. And the thing with melatonin is that it's naturally occurring. We all produce it in the pineal gland up near our brains. And it's important in the circadian or day-night sleep-wake cycle. But it also has therapeutic uses in some cases of hair loss in pets. It's actually kind of remarkable. And you can overuse it as well. But it also has an anti-anxiety effect. And it's really pretty darn safe if you don't overdo it. Most cats will only use 1 milligram. Dogs 3 to 5, sometimes as high as 10. But again, you should talk to your veterinarian before you get that high with it. And you may find that it has value with dogs who have night waking issues, especially older dogs, given at bedtime. But phobias and separation behavior sometimes will respond nicely to melatonin. So nothing wrong with that. You can try it. Don't let these problems get too severe, and remember that management changes and behavior modification and kindness and patience, you have to have that. If you yell at a pet and you lose your temper, people do. We're human. But the problem is that if they're anxious, you can scare them even more by, not backing away and counting to 10 and saying, look, let's find a solution to this thing. Now, here's something else that I'm a big believer in is pheromone treatments. This stuff is a plug-in diffuser. You can see that here. I'm going to turn the camera around to show this to you so you can read it. And this is Feel Away. This particular one is called Feel Away Classic. This is a calming pheromone. This is, you can see the, there you go, in the bottom corner, you can see the diffuser. It plugs into a wall outlet. It looks like a room freshener, but Feel Away Classic is a calming pheromone. So we have cats that are just nervous this can matter. There's also Feel Away Multicat, and it's a social pheromone for, well, multiple cat households. And it can make a significant difference in diminishing the tension between these cats. And I'll tell you, here's another one that's also from the Siva company called Feel a Scratch. Let me show you this. Feel a Scratch is something that you put on a scratching post, for example, and it has pheromones that attract the cat to scratch where you want the cat to. There's a lot of people whose cats scratch furniture and they're spraying them with water. Well, don't do that. But you certainly can use double sticky tape on the nice furniture so that they are discouraged from doing it, and there's value in that. But to teach the pet what you want them to do instead of the bad behavior, that's really critically important. It's one thing to say, stop doing it already, but what can you give them to do instead of that's a healthier behavior that actually harkens to natural canine or innate feline behaviors? This stuff is all helpful, but remember, it should never be considered the the entire solution to the whole thing. And then for dogs, there's something called Adaptal. Here we go. Miss America, come back over here. Let me show you, because you're gonna demonstrate something for me in just a minute, girlfriend. There you go. Anyway, Adaptal, this stuff comes in a plug-in diffuser. This particular method of exposing a dog to the pheromone is a collar, and it's good for about 30 days. And you can get these on the internet as well if you like. And these things are helpful as well because this pheromone goes with the dog wherever the dog goes, unlike a diffuser, which is very helpful if a dog's in a small room, but it diffuses into the air, and if you've got a big open floor plan, it can be a little bit less than effective. So this is another non-medication, very well established, very well researched method of helping a pet calm down. Now, here's another one. Okay, this is a new product. I don't have the product itself, but this is what it looks like. And I almost pushed my chair over here. This stuff is a probiotic, and it changes the microbiome, and it's called Purina Pro Plan Calming Care. Purina just used to make dog chow, but they have excellent prescription diets now, and they have these probiotics. And this stuff has bifidobacterium in it, which is intended specifically to reduce anxiety. You may have read about the microbiome and how it's getting a lot of research these days. Well, it turns out that there is a gut-brain axis, and we're only at the beginning of understanding it. We're going to see a lot more about this in humans as well as pets in the years to come. But you can actually change the hormones and the neural connections between the brain and the gut by repopulating with bacteria that promote a calmer emotional state. And the preliminary responses to the calming care probiotic are excellent. Comes in a box of 45 little packets, and it's a granule, and you tear it open, you put a little bit on the food, they all like it fine. And so it's a 6-week supply that you get in a box. And that's plenty of time to find out if it's going to be helpful. And the beauty of most of these things that we're talking about here is that if you do have a dog or a cat with a more severe anxiety problem, and we need medications, these things can be used in combination safely. Now, here's one of my real favorites. This is something that is very new. The concept isn't entirely new. When I was doing my residency in behavior medicine in one of my neuropathology classes, we were exposed to some new research on transcranial stimulation. I've got a very close friend who's a psychiatrist on the human side, and they're using it clinically right now for people with severe depression where medications just aren't getting it done. And these are real sick folks because they're so, they could be suicidal, they can't function hardly. And they're seeing wonderful results with a transcranial stimulation. This product here, this is made by Assisi Animal Health. It's called the Calmer Canine. And that's the name of it right there. I talked about this in a Facebook Live last week. There's the box. And let me show you what this thing looks like. Miss America here is wearing the vest. Can you sit up, honey? That's a big girl. You may not be able to see it real well, but she's wearing this little thing here around her chest. and she's got this, and this is just little fabric stuff with a Velcro closure, and it connects to the part on the chest, so that the point is that this little patch of Velcro here at the top of her neck is in the exactly correct position to put the targeted pulsed electromagnetic field device on there, and it simply goes right behind her head. You can see, isn't she cute? And this thing looks like a little halo, as though she were some kind of a little border collie angel, which, you know, we think she is sometimes. and so you turn this thing on, you simply push the button, and the dog can hang out with you, well, should hang out with you while you use it, twice daily, 15-minute sessions, but, you know, it's totally passive. You can be watching television or answering your email or something else, right, girlfriend? And you can, and so what this does is that it targets the amygdala, the fear center of the brain, and it works on the microglia, on the cellular level, and it adjusts the function of the cells. And we find that after 4 to 6 weeks, the majority of dogs in a very strong research project were significantly less anxious. It is approved for use for separation anxiety. It's comfortable. It's easy to use. There's absolutely no sensation. You can turn the thing on. Nobody feels anything. It does not trigger what's called an action potential in the neurons of the brain. It just very quietly makes adjustments in the cells of the brain in that particular area, the amygdala, and it changes the neurochemistry. It is FDA approved, by the way. It's not like a supplement. And you can find out if your dog has separation anxiety. You can go to the website, and it's called Calmer, C-A-L-M-E-R, the letter K, then the number 9.com. I don't pronounce the L in calm because my parents were raised in New England, and they say calm and palm instead of calm and palm. And so I say calm and palm. Anyway, it's Calmer, C-A-L-M-E-R, the letter K, the number 9.com. And you can go to this website, and they will, there's a quiz. Take about 3 minutes. But it's a very helpful way to bring to light, does my dog have a problem with separation anxiety? And if you want to, you can order one of these things on their website. You don't need a veterinarian's prescription. In fact, you don't need a veterinarian's prescription for any of this stuff. But we find that it can be mighty helpful. And I just want to expose people to some things that you can do, but I really want to discourage people from saying, well, I tried that and there was nothing I could do because, well, we tried it and we tried a couple of this other things. And, well, you know, if you're not trained in behavior medicine of dogs and cats, you might miss the diagnosis. And in fact, in my referral practice, I often find that my cases have more than one problem, often several. And we need to manage all of them, and we need to manage the environment of the pet to set them up for success. We need to teach them healthy alternative behaviors to what they're doing wrong, and we need to pick the right treatments, and I mean plural because we integrate a bunch of stuff. Very often, these non-pharmaceutical methods, and sometimes those things by themselves are alone enough. The study done on the Calmer canine did not incorporate any other treatments, and the majority of these dogs, after 4 to 6 weeks, twice daily treatments, were significantly better, and they established that using videos of these pets while their people were away at work. So, you know, this is all pretty good stuff, huh? I hope so. Does anybody have any questions? Let me see, what do we got here? Nobody has any great questions. All right. Well, you're very welcome anytime you like to go to my Facebook page, which is facebook.com/Dr. Jeff Nichol, Dr. Jeff, Nichol. And you can put questions in there for me. You can also make a suggestion if there's something that you'd like me to cover in a Facebook Live. Thank you for the hearts. That means I must be doing something helpful here, which is the whole point. So if there's something that you would like me to cover, I'd be happy to take those suggestions. I do these typically once a week, and I'll be back next week. I haven't decided what I'm going to do that one on, but I will put a notice on my Facebook page, and if you're a follower of my Facebook page, you'll get a notice of what we're going to be doing next Thursday evening. And you're always welcome to tag people or send people to my Facebook page to learn something about, to watch these Facebook Live events. And by the way, if you're also seeing behavioral symptoms in your pets, and physical symptoms, by the way, as well, you can go to my website, which is drjeffnicol.com, drjeffnicol.com. And it's searchable. And I have newspaper columns in there that I've written every week in the Albuquerque Journal for many years past, plus a whole bunch of other resources and videos. And I've done lots of those on these different issues. And you can search that stuff by symptom, and you can learn a lot about, gee, what really is going on with my pet, and what are some of the treatments that we can apply. Of course, I stay up on the research, and so, some of these articles, they're from a few years ago, and I've got newer stuff now, but you can always send me a question on Facebook, and I'll be happy to address it. So thank you for watching. Thank you for dropping by. And by the way, if you'd like to receive these Facebook Live videos, along with my weekly blog, which appears just a few days prior in the Albuquerque Journal, you can subscribe to my website. And when you do, I'll send you at no charge my at-home pet first aid and CPR guide. So that's another great way to get access to information. Ends up in your email box every Tuesday morning. So thanks again for watching. I hope everybody has a great weekend and enjoy the fall weather. Miss America, you're upside down. You're having a nap. Okay?